Hi, everybody. Welcome to another of Nairobi Garage workshops. For those of you who are not familiar, Nairobi Garage is the largest and coolest co-working in an innovation community in Nairobi and in Africa. And we currently have 3 locations where across Nairobi, where our members are able to engage with our community and have workspaces. So we host webinars every week or so to engage our ecosystem and just engage our members and our community with what's happening in the business ecosystem in Africa and even beyond. And my name is Symone. I'm the community manager of Nairobi Garage in Karen. And today we have the pleasure of hosting a Japan-based social marketing company and general manager Kenta Hara and his colleague as well, who I'll be letting Cyrus introduce shortly. Just before we begin, I'll request that if you have any questions for our speakers today, please put them on the question tab that's next to the chat. We'll also have a few questions on the polls that you can respond to just to give feedback. And just feel free to chat in the chat section as well and engage with us. We hope you enjoy today's webinar. So over to you, Cyrus.
Okay, good morning, and thank you so much, Symone, for organizing this workshop. We really appreciate. Today, my name is Cyrus Nganga. I'm the Sales and Marketing Manager for AfricaScan Incorporation. We are a subsidiary of a company called Consultation Incorporation in Japan. And basically, our company deals with social marketing here in Kenya, as well as in Japan. We are dealing and working with the government. Today, I'll be the moderator, and I would like to introduce the 2 speakers. One is Kenta. Son, who is the public room manager for a company called LEBER. LEBER is a telemedicine company in. Oh, sorry about that. It's a telemedicine company in Japan, dealing where it provides a consultation for patients with doctors. So we are going to start with Kenta-san, who's going to do a presentation about the topic today, which is a real-life application of machine learning by healthcare companies in Japan. So they are going to give us examples and experiences that they have as a Japanese company.
Sorry about that. It seems we lost Cyrus there. So Kenta and Taga, you're welcome. I think we'll begin with Kenta, and you can take us through your presentation on artificial intelligence in healthcare. Karibu.
Okay, asante sana. Ninaitwa Kenta. Ninafanya kazi AfricaScan as a general manager. And mimi ni mwanafunzi na University of Nairobi also. So today I'm going to talking about the artificial intelligence for healthcare in Japan. And I also invited another the company in Japan, which is the LEBER. LEBER is the communication platform between the medical doctor and the patient. So after my presentation, he is going to talking about the example of the services in Japan. So let me start my presentation. So I'm going to start. Wait a bit. Yes. So. Sorry. This one. Okay. Yeah. Okay. Okay. let me start. So artificial intelligence for healthcare in Africa through the Japan AI healthcare services. So before starting, I just introduced myself. My name is Kenta. Thank you for all for joining me to us today. My name is Kenta Hara, the General Manager of the AfricaScan. I would like to give you an overview of the engineering and the talk about a little bit business in Japan. So then I was a JICA volunteer for 2 years in the developing countries, doing the healthcare and SAF and industrial academia, between the industrial and academic collaboration university. Then currently I am developing the healthcare engineer business in Kenya, which is I would like to share you today a little bit. So AfricaScan is a AfricaScan is the healthcare company. Our mission is creating the health future of the Africa through the primary healthcare. So we have been working on the health promotion project in Naivasha through a kiosk business, and came in the contact with many people in the health issue and living condition there. So later, we developed a diet application to help prevent lifestyle disease such as the cancer, diabetes, and hypertension. The 30% of the people participating in this pilot study. So then we can provide a reduce of the weight during this period. So currently, we starting with the programming healthcare engineer school with Dive into Code. Dive into Code is one of the engineering school in Japan. So then we start to collaborate with this the company to develop the human resource in Kenya. So 8 years ago, we are providing to the preventive primary healthcare solution for the local residents. Then in 2021, we started the business offering with Dive into Code to train web application and machine learning engineers. So before we begin to speak about artificial intelligence, let me explain a little bit about healthcare engineer school we are starting. Our engineering school will offer a curriculum design in Japan with online materials and mentoring. As for the engineering, Dive into Code will do that. Healthcare knowledge and business skill will be provided by the AfricaScan. So if you are interested in joining us, please looking forward to hear from one of our representatives later. So this is just, so first what we will providing to the scholarship. So if you're interested, please join to the www.medicscanengineer.com. So then in the web application course, you will learn about the programming language called Ruby. The which is very short, easy to learn, and allow you a quick to create powerful web application. So this is in the comparison to Java, which is using to the many application. If you want to describe hello world on the computer, you have to write down the 3 sentences of the here. However, so if you learn the Ruby, so you just put it the puts hello world finish. So if you want to so this is the Ruby language, so you can understand so the easier than the Java. So then Ruby is developed by do you know the Airbnb? Airbnb is sharing room for the customers. So this is developed by the Ruby and Twitters and Hulu. Do you know Hulu? Hulu is one of the video streaming platform, and GitHub is also developed by the Ruby and the Kickstarter also. And do you know the Y Combinator is a famous accelerator in the US? The most popular programming language. It's in its entrepreneurship program is the Ruby. So which is a powerful, easy way to create web application using the Ruby on Rails. It's a framework. Okay, so let's go to the artificial intelligence. So I just show you the definition of the artificial intelligence. Artificial intelligence is a term often used for projects that develop the system with intellectual process characteristic of the human, such as the reasoning, meaning, discovery, generalization, and learning from the post experience. So AI, so everyone have a sometimes misunderstanding of the AI, machine learning, and deep learning. So deep learning and machine learning is including of the artificial intelligence. That means, so if you talk about artificial intelligence, this is including of the machine learning and the deep learning. So this is just the example of what is artificial intelligence. So then maybe you know the logistic regression. So logistic regression is also a most common model used in the statistic. It is also the most common analyzing method in machine learning. So other analyzing methods such as the linear regression, a Bayes, and decision tree are also part of the machine learning. So this is what is the regression model. This is one of the support vector machine. It's one of the regression model. So this is the decision tree model. So if you identify the cause of the issue, so you can use the decision tree. So then AI is good at following things. One is image recognition. Two is voice processing, and three is natural image processing. So this is actual AI I did for object detection using the AI. If you just let the machine take a picture, it is difficult for machine to recognize it as a pet bottle. However, by the reading this image into the AI, it can determine what is it. This is done by learning many images in advance, creating the best model, and then using that model for object detection. So machine can understand Fanta grape, vegetable juice, sparkling water, this is a juice, and Coca-Cola through the AI. So I just show you what is the object detection through the YouTube a little bit. Sorry.
Greater than 99 location. But what happens robotic system? It's robust to a wide variety of changes, and the entire state of the world has changed. And this wouldn't be very useful for an application. If we speed this up by another factor of 10, this is a detector running at 5 frames per second. This is a lot better, but forward, backward, this is great. This is what detections in the image, but this involves running graphs. And now we're going to do something fun.
Yeah, this is
go out into the audience and see
the
what kind of
object
things we can
detection
detect.
by
Does anyone
using to
want
the
a
AI.
stuffed animal?
Okay, let's go to the next. Then this is the image detection of the COVID-19 lung. So if you are learning by the previous X-ray, so machine learning can identify which place is infected the COVID-19, and also getting of risk of the infection disease in the lung through the AI. And this is just example of the how a machine learning detection of the images. This is just explain. So CNN is a famous machine learning algorithm for image detection. So let's see. Yeah, this is a mathematical formula for understand. Then move to the left to right. Sorry. Yeah, machine understand. Yeah. Yeah, this is a convolutional method for image identification. Yeah, if you're interested, you just visiting to this site. Okay, and voice processing also the strong point of the artificial intelligence. So this is a very famous YouTube. So let's see.
The progress with that system.
So this is a conversation between the human and the AI algorithm.
How can I help you? Hi, I'm calling to book a women's.
The left is the Google AI.
I'm looking for something on May 3rd. Sure, give me 1 second. Mm-hmm. Sure, what time are you looking for around? At 12 p.m. We do not have a 12 p.m. available. The closest we have to that is a 1:15. Do you have anything between 10 a.m. and 12 p.m.? Depending on what service she would like. What service is she looking for?
Yeah, AI can now AI can close to the conversation, can reservation, and can close to the discussion.
Okay, perfect. So I will see Lisa at 10 o'clock.
The progress with that system.
Yeah. So the classically the machine learning use this kind of the new natural language processing. However, so recent year, around the 10 years, so a neural network is increasing of the techniques. So then now we using to the deep learning through the neural network. So this is one of the Japan company. It's Emphas. So this is a Japan company called Emphas, and it is the service that use AI, natural language processing, to determine the emotions of the person speaking and promote a smooth communication in the business. It is currently used judge the outcome of the business meeting, as in Zoom and other forms of the communication are being more common right now. So I just try to use this the application on the web. So I just try to identify with my emotion. よろしくお願いいたします。 Yeah, so my emotion is very high through the AI, through the analyzing of the AI. So this is one of the services in Japan by using to the artificial intelligence. Okay, back to the presentation. So I just want to explain the Kaggle. Kaggle is a world's largest data science community and powerful tool and resources to help you achieve your data science goal. So Kaggle is a very, very big platform in the world. So if you learn about the the data analyzing, so you just go to the Kaggle. Let's go to the Kaggle. Yes, so this is one of the competition of the X-ray, chest X-ray. So many people try to make a model of the artificial intelligence. Yes, so then some people post of a result and how to analyzing of this chest X-ray. Yeah, this is a big community of understanding of machine learning and development of the machine learning model. Yeah, something like that. If you want to interest, please visiting the Kaggle site. Okay, go to the next. So then if you come to our school, you can learn about the Matplotlib, NumPy, Pandas. This is the Python framework. And also machine learning framework, TensorFlow, Keras, and PyTorch. So then what is artificial intelligence in the healthcare? I just talking about my company example. So this is not my company. So this is AUM. AUM is one of the medical company in Japan. They are providing the conversation, communication tool between the medical professionals. So then this application also providing the diagnosis of the X-ray. So then I just talking about my company example. This is a cancer scan. Cancer scan is a using to the AI in the primary health care. So do you know cancer scan is a social marketing company in Japan. So do you know the social meaning of the social marketing? So have you ever heard of Philip Kotler? Philip Kotler is known a god of marketing, and he is the one who established marketing as a techniques to change people's behavior in order to selling product. The cancer scan is a company that is introduced in this book on the social marketing. So social marketing has a primary goal of the achieve social good. The traditional commercial marketing aim at primary finance through that they can have positive social effect as well. In the context of the public health, social marketing would promote general health, raise awareness, and introduce changes in the behavior. So our services is a health promotion solution. We utilize the artificial intelligence, analysis, segmentation, design, execute, evaluation, and also analyzing of the health data, health solution. So our business, this is a big important point. In Japan, the breast cancer awareness campaign have been actively conducted since 2005. As you can see a graph as a result of the educational activity conducted in 2005, many people becoming aware of the breast cancer in 2008, 2008. However, when we look at the percentage of the people actually went for the breast cancer screening, we see the also knowledge is increasing. Knowledge was increased. The percentage of the people who actually took action did not change. So many people getting to the knowledge of the breast cancer. However, so they didn't go to a hospital to diagnose of the breast cancer. So this is a great, the big indication that increasing of the knowledge is not enough to change people's behaviors. So this is a paper of the social marketing done by one of the representative that was published this year. So in this paper, we conducted a study to determine whether sending different messages to the group into the control, group A and group 2 would result in the health checkup. So this is the control group message. This is group A message. Change the message and also same amount of the cost. So group B is the same messaging, however, it's free. So through this, as the result, it is a clear fact that optimize the message and free health checkup have been the most effective. However, what is the most interesting is that is the simple changes the messaging method transform the people, change the behaviors. So on this, between this control and the group A, it's just changing of the identifier of the message. So this is through this activity we understand messaging is very important for changing the behavior, and using to the AI to optimize when to send a message. So this is an example of our company using to the AI. So this is a before of the prior the consultation people feel. So this is the best timing of the sending the message. This is the person, I don't know how to say, emotion, the timing of emotion. So before the most good timing to send a message before a good timing. So they don't want to go. So they feel I will just take next time. I don't have the go now. So I don't have to go now. So we difficult to change the behavior, this timing. And also after the motivation, so sending the message after the motivation, it's also, so people thinking about, I totally forget to go, but I'm busy. Let's go to the sometime. So it's also difficult to change the behavior. So best timing is for sending the message. We have to identify a more motivating time during the year. So then our company utilize the AI system for identify when is the best timing to send a message. So the appropriate time to make this recognition varies from the person to person. Therefore, we are using AI to predict the timing of the recommendation, and by combining it with social marketing, as explained earlier, we are providing primary healthcare services. So this AI is based on the healthcare data provided by the local government. including to the attribute information, past medical examination history, and family medical examination history. Then this information runs through the AI. Then AI predict when is the best timing of the messaging for individual. So AI analysis will help you select the best shipping date and the best recipients for the shipping date can be selected. So the result, this is a result of through the artificial intelligence. This is a result in the 2.5 of the people are taking the action and actually going to the hospital, the non-optimized recognition group. So through this activity, through this business, through these services, we we identify analyzing of the post data has revealed that there is an optimized time for each individual to receive medical checkup. By letting the artificial intelligence learn from the post trend in the medical checkups, attribute information, and family information, it's become possible to calculate the effectiveness of each individual's recommendation by time of the year. And campaigning the result of the sending the recommendation at the optimized time with those of the not sending the recognition at the optimal time. There was a 2.4 differences in the consultation rate. So it is now possible to select the best timing to SIP and the best target audience for that time. So then this, the algorithm already took the Japanese patent. Then impact of the optimized message. So I just say 2.5. So you feel 2.5 is very small rate. However, so Japanese people, the population is 100 million. The people is 100%. However, 2.4% is the 2040. 2,400,000 people is changing to the behavior through the optimization. So that number is half of the Nairobi population. That means half of the Nairobi population changed the behavior to go a hospital, and 20% of the taking the examination, getting to understand to get cancer, diabetes, and hypertension. That means we can prevent the death of the people around the 1,000 several 100,000 people we can prevent of the deaths. Yeah, this is just example of the AI system for using primary health care. This is an example of the Japan. So next presentation, Mr. Tana talking about the application of between the medical professional and the patient. So very interesting, the application. Maybe you will be fun through the presentation. So Tana-san, please go ahead to the presentation.
Yes, thank you so much, Mr. Hara-san.
Okay, before Tana.
For the introduction.
Okay. Cyrus, go
sorry,
ahead.
Tana. Sorry for that. Before Tana, you go ahead. We have a very interesting question that we got from May Aseneka. I would like Kenta to answer. Once he's done with answering the question, then we can proceed with Tana. So the question is, will diagnostic derived from this AI be final and definite, or will you require a doctor to confirm and sign off on the results? Can I go?
Which
can
one?
I repeat? Can I repeat the question again?
Which one?
Another question.
A question, okay.
Yes.
Will diagnostic, okay.
Yes, I think what she is trying to ask, if we have an algorithm which can be able to detect in terms of diagnostics done by machine learning, will they be the final answer, or the doctors have to confirm? Yeah.
Okay. So right now, AI difficult to decide to the diagnose. So diagnose only supporting of the medical doctors. For example, so doctor have to see the much of the X-ray image a day. So then, however, if doctor put this X-ray on the artificial intelligence identify of the suspicious place on the X-ray. So then doctor only check of the suspicious place for the diagnosis. That means medical doctor have to see all of the X-ray image. However, doctor can reduce of the time for diagnose, and also deducting of the misdiagnosis in the hospital. Then right now, AI just supporting to the diagnose for medical professionals right now. It's related to the law, medical law in each country. So some country is accepting to all of the diagnosis through the AI. However, some the country didn't diagnose only the AI. So depend on the country. So Japan is yeah.
Okay, she is convinced with the answer. It is very correct and right. We have another question from Evelyn Mombi. Thank you, Kenta, for answering the previous question.
Okay.
And the question goes like, how will AI influence the activity of medical specialists, especially radiologists, and how will the digitalization of healthcare impact the doctor-patient relationship? Yes.
Okay, thank you very much. So, yeah, medical specialists, especially the radiologists. So, this field may be before radiologists have to consult the medical doctor. However, if you utilize the AI, maybe so near future. So radiologist can be diagnosed through the AI, or you can talk easily between a medical doctor and medical professionals. Maybe this is will come, and digitalization changes affecting to the between the patient and the patient and the medical doctors. So maybe Mr. Tana talking about how influence between communication between the medical doctor and the patient. Yeah, I just want to say AI affecting to the much of the maybe AI influence communication between the medical doctor and the patient. AI will support to the diagnose and the communication between the patient. So, for example, the hospital prepared a chatbot for communication between the patient. So then chatbot identify what kind of the diagnosis there are in the patient. So then after the diagnosis through the chatbot, then this information to go to the medical professionals. Then medical professionals can understand can diagnose, deducting of the time for the consultation. Time of the consultation. Maybe this is a come to the future. Maybe 1 or 2 years futures. will come optimize between the communication between medical doctor and patient.
Okay, thank you so much for that comprehensive answer, Kenta-san. We have another question, very interesting question. I think the topic is becoming interesting. So I think this is the last question that we're going to pick during this period. Then the other questions we're going to answer them at the end of the session. So for this last question, the one boy is asking, for machine learning to be accurate, it needs data. If we were to implement machine learning in healthcare in Africa, do we need to build up upon our data, or we can use data available globally? And then how long will it take to build a data bank for the continent? Yes.
Okay, this is a very
data. Yes, yes.
Okay, so this is a very important question. So if we develop the own AI system, we need to the data in original data from the Africa. For example, maybe healthcare companies and the hospital, clinic, there are much of the data in the organization, in the institute. However, maybe right now, a small clinic, small hospital, managing by the paper. So it's quite difficult to using for the machine learning. So so this is my dream of the development of the services in Africa. So we want to utilize the information, the data for healthcare in Africa. However, now there are no data in Africa. So that's why first machine learning engineer go to the hospital, then inside of the hospital, then work together for the development of the data. Then this data can utilize for healthcare in Africa. So we need the steps a little bit. And also we can utilize the information of the worldwide. For example, machine learning can utilize of the data. For example, I explained about the deep learning. So deep learning have a much of the layer. For example, 10 layer. Then beginning of the 5 layer can use previous data. For example, worldwide data. Then another 5 layer utilize the African data. So that means we can combine the data, world data and the African data. So then we can make the model of the object detection. For example, X-ray or some image, some chatbot, etc. So natural language processing. So we can utilize the both. So if you want to make the model of the only original, we have to collect much of the data through the Africa. However, if you utilize the world data, so data set of the Africa becoming small. Then combine the much of the I don't know what to say. The much of the data using to the worldwide data, then connecting African healthcare data. So then we can develop the model for the Africa. Is that okay? So that means
yes.
we need to develop of the data ourselves in the country, and also we can utilize worldwide data, combine the both of the data for development of model of the machine learning.
Okay, thank you so much, Kenta, for that comprehensive answer. The participants, they are really convinced with their answers, and they really appreciate. By the way, the word "san" in Japanese means title, like Mr. or Mrs. So you frequently hear us using the word "san." So I would like to welcome on the stage Mr. Tana-san or Mr. Tana to come on stage and also do a bit of the presentation. Thank you.
Okay, thank you, Mr. Cyrus-san and Hara-san for introduction. Myself, my name is Sena, Taga. Thanks for inviting today's presentation. It's so big honor to me. And I would like to introduce about the application, telemedical application that I provide in the Japanese market. So let me share my presentation slide. Yes. So I will talk about the utilization of the LEBER in Japan. And this LEBER is the name of the application that I am providing in Japanese market. So LEBER is a medical consultation app. You can find it on the App Store, on the Google Play. And in this month, our application got second most popular medical app in Japan, so that many people are now using my application. My application is to provide a medical consultation to the patient who need doctor's advice. So from the left-hand side, we get inquiry. The chatbot will ask you the problem in detail. Automatically, chatbot will ask you what is the problem and when the problem happens, and do you have allergies? Do you have some medical dose that you're taking? Those questions. And the doctors will provide you advice, medical advice, and the fastest you can get like doctor's advice in 3 minutes. Not only advice we provide, we also provide the solutions, such as a recommendable OTC drug that you can buy in the drugstore. And also, if you are in a serious problem, serious situation, we can also provide a hospital or clinical locations on the map like this. So this is the brief idea of the LEBER. When the patient's having a trouble or problem in their bodies in health conditions, they send details through the smartphone to the doctors, and doctors will advise suitable OTC drug or the hospital to the patient in 3 minutes. And we opened up our platform 24 hours and 365 days a year. And we have now over 300 doctors who are cooperating with our platform, which covers over 53 clinical departments. And the medical institutions that we can show on the map is over 170,000, which is all the hospital and clinic in Japan that is registered in the Ministry of the Health in Japan. And I think this is quite hard for the listeners. I will share my smartphone screen. This is like actual app. And sorry, this is this is Japanese language. Sorry, this is Japanese language. But you can start medical consultation from this blue button, and you can consult about your families. So if your son is having trouble in health condition, you can choose the son and having pain in his wrist like this. And we ask, the chatbot will automatically ask when the pain starts and what the characteristic of the painful and which wrist you have. Those questions coming automatically. So you choose the answers like this. Sorry, those languages all in Japanese. And you can take the pictures of your wrist. Yes, like this. And you can send it to the doctors. Like this, like this. About 10 questions we ask. And then you can send it to the doctors. The doctors who are answering to your health problem is like this. So we have over 300 doctors. And doctors' answers is like this. Sorry, this is again all in Japanese language, but I won't show you the ideas of the doctors' answers. So we can doctors can show you the suitable medical institute like this, so you can get the information of the near hospital from your current location. And also, if you are in trouble of like light sickness, then doctor will recommend some OTC drug. Let me find some OTC drug that doctors is, oh no, not really. Sorry, doctors sometimes recommend you some OTC drug, which you can buy in the drugstore. Yes. So going back to my presentation, and also we uses crowd RPA, which is robot process automation technology, to the doctor's side, which means doctor can make the answers in fastest 1 minute and 30 seconds. Yes, so we can reduce the burden of the doctors to the about 10%. So if doctors uses 10 minutes in the hospital to speak to the patients, in our application, doctor only uses 1 minute to answer the doctors. So which maximize doctors' resources? For example, if one doctor can check only 10 patients in a day, in our platform, doctors can answer over 100 patients a day, which maximize doctors' resources. And we use crowd RPA technologies to the doctor's side as well. Yes, so this is the idea of our medical consultation. Also, we have another function, which is a health check. And let me introduce about this function. As all of you are facing now the problem of the COVID-19, how we prevent the cluster infection? The one solution or one counter measurement is check and report everyday health condition. For example, if your children are going to the school teachers or principal wants to correct the data of the health condition of the students. So this is the idea of our function of a health check. Guardians access to our application, and chatbot will ask you, what is the temperature of your child today? Does your child have any health problem? Or does your family, any of family member having a fever or having a cough, having any health trouble? Those medical interview are made by the chatbot, and the guardian put the answer on my application, and those health condition and temperature data is going to the schools. Now in Japan, over 300,000 users are using this system, which is over 750 schools nationwide are using this system. So the idea of this function is, in the morning, we can automatically send you the message to accelerate report today's health check. And chatbot will ask you what is the temperature of your children, what is the children's health conditions, does your family member have any health trouble, automatically. And school can see the report of the students' health conditions. So this is how Japanese teachers are checking children's temperature of that day. In the teacher's room, they have monitor, and in the monitor, they can see how many students are checking today, and how many students are having a fever, how many students are having bad health condition, like those informations. And teacher can bring their tablet to the classroom, and in the classroom, they can check the data of the students. Sometimes, like one school have 3 children from the same house, so they can exchange those children's data who is coming from same family. And we can provide automatic group analysis to the school. And so many schools are having high implementation rates, such as in my city is called Tsukuba City, and the elementary schools in the Tsukuba City are having over 97%, which is the implementation rate. And in the elementary schools in Tokyo and Osaka, those are the major cities in Japan, they are having 100% implementation rate every day. And further beyond, we can provide automatic, like a real-time data-driven infection disease prevention. The idea of that is from 3 schools, we are collecting children's health data and to our system. And from our system, we can provide those data to the government. For example, this school, the top school, are having so many children who are having high fever. And then the government can give advice with the countermeasures that you should force children to take PCR test so that government can provide PCR test. And to this school, who is not having high fever children, government can only give advice that keep students to wash their hand, wear the masks, and etc. So those different advice to the different community having different health condition. This is how we utilize our health check data. And we are now developing vaccination management tools as well. And that is like all over the world, one solution towards the COVID-19 is to take a vaccination. But we should monitor who takes the vaccination and when he or she took that vaccination and which type of vaccination they took, because from different company we can get different vaccination, and the efficiency of the vaccination is different, so that we should monitor who took which vaccination. And our application can provide the system of vaccination management. And the idea of that is when the people having a vaccination, people register to our application, and people will register which date they took the vaccination and which road number and which company that vaccination was. And also we can take their names, the times means if this was the first vaccination or second vaccination or third vaccination. or what kind of symptom they are having now at this moment. And lots of companies who are providing vaccination are saying you should the person who took the vaccination should monitor his or her health condition after 24 hours after the vaccination, 2 days after the vaccination, 5 days, 7 days, 21 after 21 days after the vaccination. And we will keep sending a message to those patients, because if those people who took the vaccination are having those symptoms such as fever, chill, swollen, redness, stool, numbness, hives, then we should send a message to those people, or you should go to this hospital, or you should call the government, the Ministry of the Health, or you should take other vaccination, something like this. We should send a suitable message to that person. And and also lots of medical thesis reporting that antibody reduction is coming after 1 week, or after 3 months, or after half a year, so that we can automatically send the vaccination alert to that patient after like half year, because we know who took which vaccination. Then that vaccination, we can know the efficiency of that vaccination. So if we know antibody reduction is happening after half a year, then we can send alert and suitable message that you should have second vaccination from other company, or in your area, other COVID-19 virus is having impact, then you should take other vaccination. And also we can share those information to the schools or the companies, to managers can see who took the vaccination and who are not taking the vaccination. For example, in the company or in the school, about the 50%, or about the 60% of the people are taking the vaccination. But to achieve the herd immunity, more 5% of the people should take the vaccination. Then we can show them the figures, and we can show who took the vaccination and which group are having high vaccination test. And from those data, we can provide government which areas people are getting herd immunity and which areas people are not getting herd immunity, something like this. So we are not using artificial intelligence so far, but as there was a question, like to build the AI system, we need lots of data. This is a process of getting many bunch of data from the people, especially the health data and medical consultation data. And we are now using RP robot process automation technologies to collect the data. And this is our introduction of our LEBER application. Asante sana.
Okay, thank you so much, Tana-san, for that wonderful presentation. It was very insightful, and it was also comprehensive. We have a question for you. One from Joseph Limo, who is asking, with the shortage of skilled healthcare workers and medical and technological equipment in rural areas in Africa, are there any specially designed mobile application with AI integration requiring minimum skills that can be used in health clinics?
Yes. Okay, thank you for the question, Joseph, Mr. Joseph. Okay. We can provide our system to those of you who are the shortage of the skills, because only thing people should do is answering the question, and those questions are very simple, so that people living in the rural area or the shortage of the equipment, if you have only the smartphone and access to the internet, then we can provide special medical advice to those of you who are suffering for the disease or sickness. I hope I am answering to Mr. Josephson's question.
Yes, you have answered. Thank you so much. The application will require an internet, so it will be a bit challenging to those people in rural areas, unless now they use the USSD. Another interesting question from Evelyn Mumbi. Are there any guidelines when virtual care is more appropriate and when face-to-face is the better option?
Are there any guidelines when versus care is more appropriate and when face-to-face is the better option? Okay, yes. Well, I think it depends on the countries, because in Japan, Japanese guideline, it has so many rules, such as when you are going to the school, when your kids are going to the school, you should wear the mask, you should report your health condition, and you should keep the distance from the kids. Or, but unfortunately, our educational system is not really highly developed, so that children cannot take remote lectures. So children have to go to the school. And this is happening so many fields in Japan, such as in the business field. So that we have so many guidelines in the cares. I hope I am answering Miss or Mr. Evelyn-san's question.
Really? I'm not sure, but I think the question was, I think from how I got the question is, face-to-face interaction with the doctors is actually the one that is highly promoted by the Ministry of Health, or rather the healthcare sector in every country. Now we have the virtual way where you can be able to have a conversation with the doctor online. Are there guidelines that have been put in place to support that?
Hi. Sorry. I misunderstand the question. Yes, virtual care guidelines. Yes, there's guideline, but the law is not settled in Japan. And I heard that in USA, UK, those developed countries, the law, online, the virtual care law is settled, but not in Japan yet. And I think if I wonder if Kenyan Ministry of the Health are setting those virtual care law or guidelines to share about the Japanese condition. We don't have law. We only have guidelines. So if you do something that is not on the guideline, you're not punished in Japan. This is what happened in Japan.
Okay. But the government in Japan is supporting virtual care.
Yes. They are now trying to set the more detailed guidelines and more detailed law for doctors to practice virtual care, because this is very difficult problem in Japan. doctors are seeing patients to face for those like 100, 200 years. So our law related to the medical care is based on the face-to-face care. So, and this is the poor system we are having to change the law or to settle new law. It takes so long time in Japan. So now Ministry of the Health and the community of the doctors in Japan are having very, very intensive discussion. And now Japanese guidelines are getting changes and law is changing now.
Okay, we have one last question that for you, Tana-san. And the question is from Josephat Aholi, and his question goes like, does the app keep medical records over time, meaning the doctor can see my past history, and how does it help with the prognosis?
Okay, yes. Yes, my application can keep the medical records over time. And if you record your past history of your disease or sickness, when doctors are making answer for you, then doctor take into account about your medical history and the problem that you have now when they are making the medical advice. Yes, and if you want to keep up consultation with the doctors, you can ask doctor every day or any time you want, so that prognosis care is a variable on my application. Only if you type your medical records. Yes.
Okay, thank you so much for that comprehensive answer. I think I have gotten another one more question from Wamboe, and her question goes like, how does a platform like LEBER build trust with users that they are talking to actual professionals and that the diagnosis and prescriptions are legitimate?
Oh, this is very nice questions. Yes. Yes, about how to make the trust. Yes. First of all, I think there's two answers. First one is to hire suitable doctors, and second one is doctor making suitable answer. So starting from the first one, to hire the appropriate or suitable doctors. Fortunately, our Ministry of the Health have the system which we can check if the doctor's license is the real or not real. So every doctor in Japan has a doctor license in actual paper. And we force doctors who want to register on my platform to submit those actual doctor's license of the paper. So they are taking a picture and send it to us. And we check that on the doctor's license, there is ID number. So we can check that ID number on the system of the Ministry of Health in Japan if the doctor is like in the real or not real. Yes, and we hire only those doctors who have the registration on the Ministry of the Health system. So this is the first answer, to hire appropriate or suitable doctors. And second answer is to make doctor making suitable answer. Yes, this is a very important part to build the trust. Of course, doctors are telling not lie, but quite wrong advice sometimes. Like there's a medical thesis, academic thesis that tells a report of face-to-face diagnosis 30% of the face-to-face diagnosis is incorrect, telling advice which is incorrect. So our KPI, our objective is making patient satisfaction more than 80%. And now we got like 86 satisfaction of the users. So we can provide advice which satisfy users. But we should check if doctors are sending appropriate answers, medically appropriate answers. But to do that, we should check all the answers which doctors are making. But we are lacking the resources to check those answers. So we are now making a system which automatically check if the doctors are sending appropriate or suitable answers to the patient. So this is how we have been making trust from the patient, and this is how we will make the medically trusted answers on our platform. I hope I am answering the last questions from Wabui-san.
Yes,
Thank you, Wabui-san, for your question.
Yes. Oh, okay, thank you so much, Tana, for that insightful answers. We really appreciate the time that you have created, and also to come and participate in this workshop and engage our partners here in Kenya. I would like maybe to get the final comments from the two speakers, Kenta-san and Tana-san, before I can be able to hand over the stage to Symone. Thank you.
From my side, Cyrus.
Yes, Kenta, we can start with you.
Okay.
A comment.
Okay, thank you very much for participating in this the workshop. So AfricaScan started engineer school for healthcare field. So because in Japan there are much of the issue of the healthcare, and also Kenya there are much of the issue of the healthcare. So then we would like to solve this problem using to the technology and the knowledge and the partnership between the Japan and Kenya. So if you interest this event, please register on the online orientation program if you want. And so I would like to continue this kind of the event, inviting to the Japanese medical startup companies, healthcare companies, what they introduce our technology services in Japan. So Kenya also, there are much of the technologies startup. So I also would like to understand about this effort for the solving healthcare issue. So finally, thank you very much for participating. I'm really appreciate to concentrate our presentation. I hope to see you again in a school or in this event or in Nairobi, some restaurant. Thank you very much.
Tana-san?
Yes, you are participating on this online event. Could introduce my application. Our application is now with global engineers, so that we are ready to provide this service in English. And actually, we are now planning to provide this application and our LEBER system to the Kenyan school. I have one professor who have been working in Kenyan rural area to provide medical service. And with him, I am planning to provide this service to Kenyan field. So I hope in that time we start providing this system to Kenyan schools and companies. From today's participant, I can work I can find the people who work with me and who can support to support people in Kenya field. And also I have so much interest in African countries because I have been working in like 3 African countries so far. So I have so much interest. I hope to see you again, and I hope that I can contribute to the Kenyan healthcare field. Thank you very much. Asante sana.
Okay. Thank you so much, Kenta and Sena, for that awesome session. We've definitely learned a lot on the different ways that our healthcare systems can integrate AI for faster diagnosis, for increased healthcare access, and even preventive healthcare support. It's also encouraging to see that AI integration is feasible in places with minimal technology through the use of mobile applications, and even more intriguing to see that AI can be useful even in our school systems, not just in healthcare organizations alone. So we really appreciate your time and your expertise, and we really would love to engage with you whenever you're in the country. So when you are in Nairobi, please drop by Nairobi Garage so that we can meet you in person and continue to engage. Thank you also, Cyrus, for being a wonderful moderator. We really enjoyed this session, and we are grateful for you reaching out and us being able to organize a session as wonderful as this. And to all the attendees, thank you so much for joining in and engaging with the speakers on this subject. Your questions were so enlightening, very creative, and it's good to see that you understood what we were talking about today. So we are delighted to extend to each one of you a free day pass to join us at Nairobi Garage. You can come and work at one of our spaces, engage with our community, use our meeting rooms. We'd love to have you here. So you can expect something in your mail before the end of the day, along with the recording from this session, which we'll also share with our speakers as well. So if you're interested to know more about Nairobi Garage and engage with our community, you can do so by just sending us an email at join@nairobigarage.com, which is in the chat section as well. So thank you, everyone. Please join us next week, next Tuesday, for our workshop, where we'll be focusing on personal finances with the founder of Money Clinic, Amos Ngahu. Thank you so much. Have a lovely day, everyone. Bye.
Thank you very much.